Welcome to Knife Skills. My name is Dr. Rich Hilsden. Thank you for joining us. Today we have a really special day today. The reason why is Dr. Tommy Chan and myself did a live about a month ago after Hailey Bieber's hospitalization for what was stroke-like symptoms. And this week, she took the time to share with us her story. She was actually able to tell us so much more about what happened. And I wanted to bring Dr. Tommy Chan back online once again to let us chat a little bit about Hailey Bieber's symptoms. So we're just going to add him to the stream right now. Tommy, how you doing?
Hey, I'm good. Good morning, Dr. Hilsden. How are you?
Put my headphones on here. How are you this morning?
Good morning. I'm good. Yourself?
Good. So a bit of an eventful week for us. We had a relatively popular video that we posted about a month ago after Hailey Bieber was hospitalized with stroke-like symptoms. And if you remember, the hypothesis at the time for us was that this was maybe more of a migraine with aura or something to that effect. Because in her age category, she's only 25. That's probably the most common cause of a neurological deficit. But it turns out things are a bit different.
Yeah, it was interesting. I saw the video with her explaining what happened. And first of all, it was a great video. She kind of took us like step by step. And I think, Dr. Hilsden, you did a video earlier or yesterday.
That's right. I posted a video on Thursday following this, following her revelation. I think she explained to us on Wednesday that she had all these investigations and tests, and we'll get to the cause of her symptoms in a few minutes. But I really wanted to have us actually take a look at her video together and react in real time and get your sense. So I was hoping today I've already loaded up her video here so we can watch in a few minutes just to kind of respond and maybe explain a few of the things that she talks about. I will say the one thing that really impressed me about her video, and I don't know if you agree, because I know you saw her video as well, was really how well she seemed to understand the whole events and what was happening to her. As a surgeon doctor, I always find myself maybe a little bit unsure as to whether the patients are totally understanding, but I would say in Hailey Bieber's case, it's undoubtedly that she knows like what happened to her.
Yeah, I think give her credit. I give the people around her credit for probably a lot of good communication. I think nowadays it's really good for the patient to really understand what they're going through. So like it's more about looking into the future, right? If these were to happen again, like what should you be concerned about? And I think with the generation that the doctors that that are trained, we should really learn to do the same, to really have that good communication with our patients so that they understand their condition better.
Well, one of the things I absolutely love is that she's got a great platform. That video itself has had 3 million viewers. And so she has a great opportunity to share with people some medical knowledge that people like us with a little smaller audience have a little harder time communicating. So I think that's great when celebrities like her can be as public about their medical conditions. I think that's a great way to help people understand what's going on. So that's actually what inspired us in some ways to do these videos, to hop online and share a few things. So why don't we not waste any time here? We'll load up Hailey Bieber's video. Let's see if I can get it here. There we go. And we'll play it. Let me know if you can hear it, Tommy, and then we'll go from there.
Hey, it's Hailey, and my voice is a little gone. I'm making this video because I wanted to tell this story in my own words of just where I've been at health-wise for the last month and kind of what I've gone through and what the story is here. I think, as some people know, a lot of people know, or you may not know, I had like a very scary incident on March 10th. Basically, I was sitting at breakfast with my husband, having a normal day, normal conversation, and we were in the middle of talking. And all of a sudden, I felt this really weird sensation that kind of like traveled down my arm from my shoulder all the way down to my fingertips, and it made my fingertips feel really numb and weird. And I was sitting there and I was kind of going like this, trying to figure out like what the sensation was and where it was coming from. And Justin was like, "Are you okay?" And I just didn't respond because I wasn't sure. And then he asked me again, and when I went to respond, I couldn't speak. The right side of my face started drooping. I couldn't get a sentence out. Everything was coming out like, not even jumbled, just like couldn't get any of the words out. So obviously immediately I thought I was having a stroke, like a full-blown stroke. He thought I was having a stroke, so right away he asked for somebody to please call 911 and get a doctor. Where we were, there happened to be a doctor there, a medic there, who rushed over, and they started asking me questions. They started testing my arms. Definitely the scariest moment of my life. I had so many things running through my head. The number one thing being, I'm having a stroke. I'm really scared. I don't know what's going on. I don't know why this is happening. Am I gonna have permanent issues from this? Like, so many things were running through my head that were really freaking me out.
So just pause there for a second. So Tommy, what are your thoughts there with those initial symptoms that she's describing? She described kind of a sensory symptom in addition to weakness and difficulty forming sentences. Any immediate thoughts, or at least, go ahead.
So going back to when we first did this video on speculation based on like the articles about she developing stroke-like symptoms, I think she clearly identified a few things at her dinner table or breakfast table. Is that she developed a sensory deficit, which is the numbness in the right arm. Secondly, she expressed some sort of aphasia, meaning that she has difficulty with expressing language, but she's able to comprehend because she said she was able to understand what people are saying. And then thirdly, there were more motor deficit, which is the facial droop. And I think that through the video, it sounds like she didn't really specify. It was pretty acute in onset. If Dr. Hilsden, you recall last time we spoke, to really distinguish between migraine with aura, transient ischemic attack, seizure-like events, the most important question to ask or to elicit is the onset. Because if it's a migraine with aura, I was telling you about, it's usually gradual, develop over minutes. You still can get the symptoms that you expressed. But as opposed to something like a transient ischemic attack, like a TIA or mini stroke, things are so fast. It's a split second.
Yeah.
So in the information she said, it sounds like it is leaning towards a transient ischemic attack because of how quick it occurred. And also with the motor deficit, with the facial droop, it points towards more of an ischemic event than a migraine with aura event, because usually motor deficit as a symptom of an aura in migraine, it's a bit more uncommon.
And my other question is, it does seem, at least again, someone who practices general medicine as opposed to being a neurologist, it does seem that her motor and speech, the sidedness of the symptoms that she's having seems to fall in line with what we understand the sort of distribution of responsibilities are for those regions in the brain. With migraine, do you find it localizes as clearly as it does in this case? And maybe you could explain to the audience what I'm talking about there.
Yeah, I think so. How our brain works is that our left side of the brain controls the right side of the body, and the right side of the brain controls the left side of the body, right, for most people.
Right.
And so assuming Hailey Bieber is right-handed, then her language center will be on the opposite side. So we call it the dominant hemisphere. So for her to experience the sensory, the language, and the motor system all on the same side, it makes sense.
Right. And would a migraine necessarily do that? Or if there were neurological symptoms?
Migraine is not uncommon to have the similar symptoms that she described, but with the caveat that if somebody has a motor phenomena, in her case, which is still in theory it could,
right.
Again, it would be less common.
Awesome. Yeah. So, and another thing you mentioned is that she's right-handed, possibly, and we don't know, but assuming she is, in almost all cases, that means that the speech is left-sided. But I also understand even for left-handed patients, although they're more likely to have a right-sided speech, the majority of left-handed people still have left-sided speech. Is that correct, or am I mistaken?
Yeah, that's correct. So, language, not speech. Again,
okay,
speech
language. Yes, okay.
Articulation. Language is high brain center. You're right. But with people who are left-handed, there's still going to be a good proportion of patients going to still have the language dominant center on the left side of the head. So you're correct, Dr. Hilsden.
Awesome. Let's keep seeing what Hailey has to say.
Really, really, really scaring me. The facial drooping lasted for probably like 30 seconds, maybe a little bit more. I honestly, I couldn't see myself, of course, so I don't really know, but I do know that it like subsided fairly fast. And so they were asking me questions and, do you know where you are? Do you know your name? And I knew all of the answers in my head, but as soon as I would try to say it, I just could not get it out. It was like my tongue and my mouth just could not form the sentences and the responses. So obviously that was really, really scary. So I got up, I could walk totally fine. At that point, it was really just like the speech issue. Went back to my house, waited for the ambulance to come. At that point, speech started to come back a little bit, got in the ambulance to the hospital. There was actually a funny moment where they were calling into the hospital to explain what they were bringing in, and they were like, I have a 30-year-old, I'm 25.
I always love that.
I had to make sure that they weren't going to age me 5 years for no reason, you know? And I noticed that when the speech came back and I felt like I could talk, as soon as my anxiety would like settle in or hit me, it would make my speech feel funny again. When I started feeling really scared and really anxious, it just made everything worse. But by the time I got to the emergency room, I was pretty much back to normal, could talk, wasn't having any issues with my face or my arm. They did like the stroke checklist in the emergency room and I scored a 0. I wasn't having any symptoms anymore. So basically, they did some scans and they were able to see that I had suffered a small blood clot to my brain, which they labeled and categorized as something called a TIA. I'm going to try to put the definitions of everything I talk about under here so that I don't butcher it.
All right, so I'm going to pause it there for a second. So one thing I found interesting is that she had no neurological symptoms when she arrived at the hospital. I think it doesn't surprise me that in this system and considering her status that she had probably an urgent imaging, maybe an MRI, maybe a CT scan, and identified actually some clot present. I wonder if, Tommy, you'd be able to explain to us a little bit what they might have been looking for there and maybe what studies they might have had. Would this have been like a stroke protocol that they would have done? Because interesting, you posted this week, you were on call for stroke neurology and had to deal with some stroke protocols that kept you up at night, and you posted that on your Instagram.
Yeah, I think when somebody develops an acute onset neurological event deficit, obviously they would call 911 and ambulance would arrive. And when she referred to some of her assessment that she received will be part of the stroke protocol, quite universal. So meaning that they do run through the checklist, and she did mention about the stroke scale, which is a scoring system to grade how severe a stroke is. So, but that gets really specific. But because her symptoms developed so fast, and then it was gone so fast, by the time she was assessed, she basically scored a 0. So in that case, when she arrived in the hospital, the first thing that one would do is to do that stroke scale if it wasn't done in the ambulance. And then they would be pushed to the CT scanner is the first thing to get assessed, because CT scanner is more accessible, is faster. And what they do right off, first thing they do is they do a CT scan, plain CT of the brain, to make sure that this neurological event is not secondary to a brain bleed. Okay, because people often think stroke is just a blood clot to the brain, right? But we know that stroke could also be due to bleeding in the brain. So because the reason behind that is you don't want to give a clot buster if that's the treatment of choice in a scenario where a patient is eligible, you give a clot buster for someone's bleeding in the brain, that could cause more harm than good. So that's the first thing you do as plain CT, followed by an angiogram, which is contrast studies to look at the blood vessels going to the brain and to see if there's any blood clots. When she mentioned that there was a blood clot that was noted, I would take a step back and ask the question that, because if there were live blood clots identified in the angiogram, most likely she would not have a stroke scale score of 0, and she would still be very, very impaired if there was a live clot. I would think she was referring to a sequence of the angiogram called a perfusion study, meaning that they compare the blood flow, blood volume, and the time. Basically, it's an equation that generates from the computer to hypothesize that, you know what, there's a part of this brain region at this moment that there are some impairment of flow. It takes a little bit more time for blood to get there, and the volume is a little bit accumulated there, and we call them a mismatch. So based on that, you could then speculate that, oh, this person had suffered a transient ischemic attack. But with a caveat, one more thing I would say, Dr. Hilsden, is that you could sometimes see this with migraine with aura as well.
Oh,
if
interesting.
you just look at the perfusion, because there's a theory that perfusion is also affected with migraine with aura.
Right,
but
right.
It will not be more of that mismatch. But in her case, I think that it was based on the perfusion study that they found a mismatch, and they speculated that was a TIA.
But you would say that that study isn't conclusive one way or the other typically. So yeah. And it's interesting because obviously 25, you're starting to think you're leaning towards a TIA. Now you're going to be starting to ask questions, say, well, why does this 25-year-old all of a sudden get stroke-like symptoms, right? That's going to be unusual, abnormal. You're going to start going down a path of more investigations.
Yeah, exactly. So if somebody calls up the ambulance and says, hey, do we have a 30 and she's 25 and that they're having a stroke, often you will ask like, wait a second, is that really truly a stroke? Right. I think that later in the video, she did tell us that she also is a sufferer of migraine. And I'm sure Dr. Hilsden, you're going to play that through and then we talk a bit more.
Yeah, we definitely are. One thing I do want to do, let's see if I can pull up on my screen here. I just want to share, and let's see if this will load. This is the we're Canadians. This is the Canadian Heart and Stroke Foundation stroke symptoms that you should be aware of, just so the audience knows what to look for. And so they have this fast mnemonic. So face, is your face drooping? Arms, can you raise both of the arms? Speech, is it slurred or jumbled? And then, of course, if you have any of those symptoms, call 911 right away. Interestingly, Hailey actually endorses symptoms, 3 of these symptoms, or at the very least, they were evaluated to a certain degree. She reported some facial drooping, reported some weakness in her right arm, and certainly probably the most clear set of symptoms that she describes in this video is her speech. So again, if you or a loved one has experienced those symptoms or does experience them, these are what you should be aware of. And this is what the Heart and Stroke Foundation recommends everyone be aware of when it comes to sudden stroke-like symptoms. Okay.
I want to point out, Dr. Hilsden, the reason why there's a T at the end is because time is brain. So
time is brain, yeah.
A lot of our audience probably aware of with cardiac conditions, when people have heart attack, like you want to do the same thing, because the longer you wait, the higher the morbidity and mortality rate, right? So the brain is the same thing from a morbidity point of view. When they assess how, if you can do a treatment for a stroke, let's say a clot buster or a retrieval of blood clot through an endovascular treatment, like the earlier you do it, the most likely your patient is going to have a more promising outcome a few months down the line.
Yeah, and I think there's a natural tendency sometimes for people to like hope it gets better, right? And of course, every moment that you're hoping it gets better is time that you're wasting away from treatment. And this is super important. One thing that impressed me about Justin and Hailey, maybe there is a bit of humility when it comes to being a celebrity, where you're used to relying on people outside of yourself for expertise. They have accountants, lawyers, legal team, PR handlers, all these types of people. Seems like Justin and Hailey at the time were very comfortable asking for help in this critical situation. And sometimes I find people are a little bit hesitant to reach out and say, you know what, I'm going to call 911 or I'm going to ask for help. So I want to encourage anyone in the audience watching this. Remember, if there's something sudden, neurologic, sudden chest pain, sudden anything that's concerning, don't wait. Definitely ask for help. All right, let's keep going here. We'll put Hailey back up on the screen here.
It's like having a mini stroke. It definitely feels like having a stroke, except my body was able to resolve it pretty quickly, and then I didn't have any more issues for the whole rest of the day and the whole rest of the time that I was in the hospital. I felt really thankful and grateful for that it wasn't worse. I wasn't going to have any permanent issues, but my scans did show that I had a lack of oxygen to a certain part of my brain for a certain amount of time. Still definitely really, really scary. So when I was in the emergency room, they kept me overnight. They did tons of tests. They did blood tests to see if I had a clotting disorder or if I had an autoimmune disease, or they did everything. And anything that they could think of, they did. They also did a certain test called a bubble echo, which is when they do an echo on your heart and they take saline and they kind of, I don't want to say shake it up, but they make it so it has bubbles in it, and then they put the bubbles in your vein to see if you have any bubbles escaping out of any part of your heart. And what they're looking for in that test is something called a PFO. Basically, what a PFO is something that you are born with, and typically at birth it's supposed to close on its own, except sometimes it does not. And it's a flap that's kind of like this between the right and the left chambers of the heart. So when I was in the emergency room, they did this test, they didn't see anything. They told me that I didn't have a PFO. So the next day I was discharged and I went down to UCLA to see some more doctors, to do some more thorough in-depth testing, because at that point they didn't really have an answer or a conclusion for why this had happened. They did come to the conclusion of why they think I had a blood clot in the first place. And the conclusion that all of the doctors came to was three different things. One was that I had just recently started birth control pills, which I should have never been on because I am somebody who suffered from migraines anyway, and I just did not talk to my doctor about this. So ladies, if you suffer from bad migraines and you plan on being on birth control pills, make sure you tell your doctor, because having a stroke is a potential side effect from birth control pills. The second thing was I had recently had COVID, and that was something that they thought was a contributing factor. And then the third thing was that I had recently gone on a really long flight. I had flown to Paris and back in a very short amount of time. And I slept through the whole flight both ways, didn't get up and move around, never thought about wearing compression socks. So basically, all of the doctors came to the conclusion that it was a perfect storm that led to me having a small blood clot.
Okay, let me just pause that for a second. Lot to talk about there. So let's go in reverse order. She talked a little bit about some of these causes of a potential blood clot in her leg, or causes of blood clots in general, and the issue of migraine and birth control pills. Now, we talked on our last live that we did this issue, and just to remind the audience that certainly in certain types of oral birth control and certain types of migraine symptoms, that might be a contraindication to taking those medications, but that's not always the case. So maybe, Tommy, you can remind us a little bit more about what is the risk between birth control and migraines? What's that relationship?
I think I'm glad she actually took us step by step on the explanation that she received from her medical providers, because that's what we discussed last time. And we said that she actually used the word perfect storm. I believe I used the same two words to explain how people could develop such an event or an aura. Because if somebody has migraine with aura, they do have a relatively increased risk of stroke. We talked about this, but absolute risk is low for somebody who's in their 20s. We talked about that. And then if you talk about another layer of if she got COVID, then she's in a hypercoagulable state, meaning that you have more of a tendency to develop clots. And when you take the birth control pills, also that relatively will increase your stroke risk. Again, absolutely low.
Right.
But now we're adding layers to it, right?
Right.
To the thing.
Yeah.
And then she also were in a long flight. So immobility is known to put you at risk for blood clot. And one thing we did not discuss last time is we did not know she had a PFO. Okay.
Yeah.
So a lot of those risks that she identified put you at risk for a venous clot. Okay, I know some audience may not know the difference between veins and artery.
Yeah, we should definitely mention that.
Yeah, so if you have a venous clot, but you don't have a PFO or you don't have a right to left shunt in your lung, these clots still cannot get to your brain. The brain needs artery to go up, right? So, but if you have some sort of congenital variant, such as a PFO, which I want to say is so common, it's found in 1 in 4 people. And Dr. Hilsden, you mentioned that in your video. And so with that being the last gate, if she doesn't have that, if she has a PFO, then with all these risk factors, perfect storm adding up, boom, there could be what we call like microemboli or emboli that shoots over. But one good thing is she was also tested for other hypercoagulable states, such as any genetic factors that would put her at risk, such as like factor V Leiden and like that. So, but I want to say with all those things that she pointed, people could get an aura that's associated with their migraine that presents very similar to her with all those risk factors. But the presentation will be more that gradual onset rather than the acute onset that I was telling you about.
Yeah, and one of the issues that we did mention is there is a relationship between the type of birth control and the type of migraines that you get. A migraine just without aura, a migraine, rare migraines, and low dose birth control is usually not a contraindication and something that a young woman could take. But you start to add a situation where maybe they're taking birth control with indications for acne management. Sometimes you'll have higher doses for that reason. You're taking birth control because you've got difficulty with your periods. You might need to use a higher dose for that. And then you add in someone who's got migraines with aura. Now you might be getting into a situation where there actually is a real meaningful risk of stroke by combining those together. So every patient situation is unique. And of course, as we always say, this is here, we're just educating people. We're not providing any individual advice, but there are situations where maybe you would avoid oral contraceptives in a woman with migraine and aura, and other situations where you might, with good judgment, talking to your doctor, make the decision to proceed with oral contraception. So one of those interesting situations. Let's go back one more step and let's talk a little bit about this bubble echo and the diagnosis of a PFO. So they were looking for a PFO, just to remind you, and they did a bubble echo and they didn't actually find any evidence of a PFO. So Tommy, what are we looking for in that study? What's the kind of the concept of a bubble echo here?
So she did explain about the bubble study, about they're mixing the syringes to create bubble to kind of put it in your veins to see if that they could detect these air bubbles going through from the right side of the heart to the left side of the heart, which if somebody doesn't have a PFO, then you will not see that. But we know that with every test, there is it's not perfect. So there's different sensitivity we talked about of tests or to see that if you get a negative test, that how confident are you in saying that this was a true negative test. So in her case, I believe that when she said she received the echo bubble at her first hospital site, it was probably the standard transthoracic, meaning they put the ultrasound in your heart. But the gold standard of detecting something like that is something that's called transesophageal echo, which you do have to organize that test because they actually have to go into your esophagus, which is your food pipe, which is going to be, when you put the probe in there, you're much closer to the heart. So you basically have better view of seeing, detecting the bubble. So I think that when she had the negative test, my speculation is that she had the transthoracic rather than transesophageal. Because she did mention later on she had another test where they were able to detect bubbles were actually seen up in the brain.
And that test was negative probably because, again, the transthoracic, we guess, this one where they just put the echo probe on the chest, is less sensitive than the transesophageal. The other thing is usually with that, you require more sedation because it is more invasive. It's a little more uncomfortable for you. And so that may have been why they proceeded with the less invasive test and moved on to more invasive tests.
Exactly.
I'm going to put a question here on the screen here from Bruno. He says, and this is something you could answer, Tommy, what's the maximum time possible for a brain to go without oxygen before you start to see, where it could be reversed completely? And I know this is going to be a difficult one to answer because it's probably a moving target.
Yeah, exactly. I think that's a very good question. And let's take a step back because people back in the day said that, if you had complete resolution of your neurological symptoms within 24 hours, let's say in Hailey Bieber's case, she had those symptoms and they persist the entire time she was in the hospital, but recovered the next day. And you still classify that as transient ischemic attack because your brain found some ways to be able to bypass that blood clot, and then you had a mini stroke. But when they start looking at more diagnostic imaging, if somebody truly had a blood clot in the brain for more than like 5 minutes, like most likely their stroke-like symptoms will be somewhat permanent if you don't intervene. So in that case, you're actually suffering a quote unquote, she mentioned, a full-blown stroke rather than a mini stroke. So when you say the maximum number of time, we often want to say that like anything kind of beyond even a few minutes, like you're most likely entering irreversible stage. Unless, again, it's a huge caveat to this because everybody's brain anatomy is a little bit different. We have collaterals, we have our circle of Willis, if people know what that means, meaning that if one thing's blocked off, we do have other things coming around that compensate for it. So there's too many variables to put a time. It is a moving target, not just a moving target. There's variation from individual to individual because for somebody, they could have a major blood clot in one artery. They might not even have any symptoms if their collaterals are doing all the great job and if their circle of Willis is like pristine.
So, yeah, there's multiple blood vessels feeding the brain that can compensate for the other things. I mean, the way to think about it might be in my world, in the trauma world, if somebody has a traumatic cardiac arrest, their heart has stopped beating. You have, seconds to minutes, really. You're talking about loss of neurological tissue very quickly, because this is an example where there's zero blood flow to the brain, like zero, and right, there's no small capillaries, there's no watersheds or anything like that happening. Zero. The neurological consequences are quite severe. So stroke is unique because unless it's a very, very, very dense stroke, you might have symptoms that are less clear. You might have again collaterals partially compensating for that blockage. Bruno had another question for us. I'm going to disagree with him a little bit here. So Bruno says women can use progesterone-only pills. Oh, they can't. Women can use progesterone-only pills. He's not saying they can't use pills with estrogen. Yes, that is a good point, Bruno. That is an option. Progesterone-only pills are an option for women with migraines. I thought he was saying you can't use estrogen pills at all. But
I would be surprised. I think in Hailey Bieber's case, because of what she experienced, even though that she later on had the procedures to correct the PFO, she's probably going to having a discussion with her medical provider on a selection of an oral contraceptive pill that is more suitable in her case. And maybe that may be a progesterone-only pill. It may be an intrauterine device. So that's kind of, again, that's very a case specific, and you should always kind of don't just think that it's not a blanket statement.
But that's a great point because she's unique in the sense that she has actually had a endovascular event. She's actually had a stroke, so to speak, from our perspective. So she would be in a lot of ways in the highest risk category for someone at her age, right? Like you would absolutely very seriously consider the medications that she's on because of this. And in fact, she ended up on blood thinners later on, which we'll talk about in a few minutes. Let's keep going and see what else she has to say.
And that was the conclusion. So they still didn't know necessarily how the blood clot traveled to my brain. So when I went down to UCLA, we did some more in-depth testing. And when I went there, they did something called a transcranial Doppler, which is basically a much more accurate test to find a PFO. And what they do is, similarly, they do the saline with the bubbles, they inject it. But with this test, they listen for the sound of bubbles escaping in the heart. If they don't hear anything, presumably you don't have a PFO. If they hear a little bit, you might have one, but it's small. And if they hear tons of bubbles escaping, you have one, it's probably large. So I did this test, and they actually found that I had a grade 5 PFO, which is the highest grade that you can have. So mine was fairly large. But at this point too, I was just grateful that they found it and that they knew that it was there. And also the conclusion was that I had a blood clot that traveled into my heart. And instead of what typically happens if you have a small blood clot is that the heart will filter the blood clot to your lungs, and your lungs will absorb it because the lungs are so big and they can handle it. What happened?
Okay, I'm just going to pause there because this is the meat really of the conversation today is her ultimate diagnosis of a PFO. So I'm going to get you to keep answer some questions for me, Tommy. What is this transcranial Doppler test? And I will admit, this is something I didn't even know existed until I was doing my surgical residency. So I could definitely learn a bit from you as far as what the test's all about.
Yeah, so transcranial Doppler it's a way to measure microemboli when you put an ultrasound probe basically on your head, and you detect how many. There's different measurements on how many, and then there's grading. When she mentioned about the grading that she's a grade 5, she's implying that there's more than 150 of microemboli, I think, per second, and meaning that there are a lot of bubbles going through, detecting at this part of your body. So if you can detect it from here, that's meaning that there's something crossing over from the bubbles that we have created, putting in your veins, which is supposed to be on the right side of the body, right, the venous system.
Right.
And you can detect it here, which is your left side, your arterial system. That means that you know that there's something crossing from right to left. And yes.
So what she mentioned, she said, normally what happens, because we in our day-to-day lives can have little tiny clots form and they end up in the venous system. For most of us, what happens is that the right side of the heart pumps it to the lungs, and then it gets stuck in these little capillaries in the lungs, and they don't go any further, right? The capillaries are so small, they really only allow one single red blood cell through. And so any clot of any meaningful size wouldn't even go through a capillary. So the lungs are this great filter. And I remember in medical school, one of the professors used to say that's one of the important roles of the lungs is to stop those right-sided clots from getting to the brain. It protects the brain, which I think is kind of interesting. And Hailey described that, I thought, really well for her audience, say, again, there's that filtering mechanism that the lungs perform. But with a PFO, potentially anyway, that's not happening.
Yeah, exactly. So like you're putting yourself at, we're constantly having these microemboli that's created, as you have mentioned. And another thing to point out is that if somebody were to have a right to left shunt, such as a PFO, you do mix venous blood and arterial blood together, meaning that some of them are oxygenated, some of them are not. So venous blood, meaning the blood doesn't have enough oxygen. That's why they're trying to travel back to the heart, then to the lungs, so you get oxygen and then
right
through the body, right? But at times when there's mixing of these two bloods, and for example, like through a PFO, you actually create an quote unquote inflammatory state of creating microemboli already because of a mixture of a venous and arterial blood, meaning the oxygenated versus oxygenated blood. Plus, now that you have a PFO, meaning that if microemboli are created, they could be moved to the left side of the body,
right,
which that includes the brain. And if
right,
the PFO is big, then there will be more emboli that could travel through. And so, end of the day, you kind of like see, how much risk does she have right now, right? Like we're adding more layers and layers to her story because that perfect storm is hitting her, really hit her hard that day with all this information provided.
And she at least reported on her video that her PFO was more than a centimeter in size. It was like somewhere between 12 and 13 millimeters. What's your thought on the size of that PFO? I know neither of us are cardiac surgeons or anything, but that strikes me as a fairly large hole in the heart, so to speak.
Yeah, it is like I'm not gonna pretend I know all the gradings of a PFO.
Yeah, exactly.
But based on the grading through the transcranial Doppler and the size over that centimeter, it is within the pretty large range.
And yeah, so let's talk for a second about exactly what a PFO. So PFO stands for Patent Foramen Ovale, and one of the things that people need to understand is that this is a congenital thing. Hailey would have been born with this, and I don't know if you want to explain, Tommy, a bit about the fetal circulation, but essentially, when you're a fetus, that PFO plays a really important role.
Yeah, well, I'll defer that to you, Dr.
No problem. I guess at the end of the day, the surgeons probably wanted to be talking about that type of anatomy. So in the fetus, the lungs aren't doing any real activity. Okay, all of the oxygenation that a fetus gets is through the placenta. And so the mother will breathe essentially for the fetus or baby as well. And she's producing oxygenated blood, and the uterus is very vascular during the stage of pregnancy, and the placenta picks up that oxygen from the uterine wall and then transmits it down through the umbilical vein, which the umbilical vein does enter into the inferior vena cava. And what ends up happening is that you end up actually bypassing the lungs with your oxygenated blood into the left side of the heart. So you bypass the lungs in two ways. There's the foramen ovale, which is between the left atrium and the right atrium. And then there's the ductus arteriosus, which is between the pulmonary artery and the aorta. And so that allows that oxygenated blood that's come from the placenta to essentially get to the left side of the system. So in a fetus, there is that right to left shunt. That's a critical part of fetal circulation. So what happens at birth? Well, at birth, fetus takes a big breath and exhales essentially fluid in the lungs. And what happens is that that lung side, the right side of the heart, becomes incredibly low pressure in a instant. So the baby's born, takes a breath, the pressure on that right side drops dramatically. And instead of the right side being the high pressure side in the fetus, the left side all of a sudden becomes the high pressure side. And that causes that PFO to flap closed, and you begin to separate the left and right sides of the circulation. Now, the ductus arteriosus actually closes a little bit later. It doesn't happen like a snap like the PFO does, but it does close very quickly, and in short order, a baby will have a complete separation of their left and right circulations. And of course, sometimes babies will have congenital defects, and there'll be medications that you'll give, anti-inflammatories, for example, that will try to slow down the closure of that ductus arteriosus to encourage some mixing of the left and right if there's a specific congenital abnormality that a fetus would have. Now, recognizing that that's definitely stretching my knowledge here. I'm not a pediatric surgeon by any means, but those are the type of issues. So Hailey Bieber would have, from the moment she was born, had this PFO in place, and would have been having some communication of the left and right circulatory systems right at the get-go. So anyway, I find that super interesting. That sudden change when you're born is in my mind absolutely fascinating, and it's a cool part of just biology in general.
Mm-hmm.
One question here just popped up. Alice Gray asked a question here: would pregnancy cause the same stroke risk as birth control pills? That's a good question. I actually don't know the answer. I'm not sure if you have any thoughts on that, Tommy.
I guess the same. I would not say that it could carry the same risk. Pregnancy does put you at a hypercoagulable state, right? So when people develop a new neurological event, let that be a migraine with aura, transient ischemic attack symptoms, during pregnancy, we do have to be alert and consider these potentially be red flags and do appropriate scans. But One limitation is that so when someone is pregnant, like CT scan versus MRI is really a discussion to have with in terms of radiation exposure to the baby, right? So we would prefer MRI over CT scans, and obviously that's the centers depending on how fast you can get one if someone were to develop symptoms like that. So we have had people who's pregnant who very similar to Hailey Bieber's case, the stroke protocol gets activated. In those cases, because of the urgency, remember the time is brain,
Right.
we still have to discuss, you know what, we need to get a CT scan, even though we know that there's going to be exposure to radiation, because urgently, like that's the fastest scan you can get, unless you have some ways to get the MRI within minutes.
This may not be a question you can answer because we're getting it out into the weeds. Would a patient who has a migraine with aura, because we know there's an increased stroke risk in that pattern of migraine, would pregnancy increase that person's risk of having a stroke from your perspective?
Again, another layer on top, right? So
Yeah.
I think that like you're just adding more risk factors.
Right.
When
Right.
it becomes absolute. I do want to mention that because we talked about PFO, a great explanation, Dr. Hilsden, on why we had it, why it's closed. It's so common that 1 in 4 people have it. So like maybe you have it, I have it. I have no idea. I've never had an echo done.
Yeah, exactly.
Doppler, but I've never had a neurological events like that. So a lot of people are walking around with asymptomatic PFO. So that's very, very important take-home point. So don't let this case be something where you start talking to your doctor and having a lot of investigation done for the purpose because, oh my goodness, I also suffer from, let's say, migraine with aura. And I want to mention because the association of migraine with aura and PFO, it's actually even higher than 1 in 4 people. So
well, I was going to chat with you. I think that's a comment I'm going to ask later, a little bit about more about that particular relationship because I think that's super interesting. But that's right. I think for the audience, recognize that PFO is probably the most common congenital abnormality that I'm aware of, and 1 in 4. That means there are people who have watched this video today that have PFOs and probably don't know about it. So the vast majority of the cases, PFOs are nothing you need to worry about. They're usually tiny and really clinically insignificant. In the Hailey Bieber situation, you have someone who had a high risk of getting a clot, period, because of all the perfect storm we talked about, but also had quite a large PFO, enough to have a grade 5 on that transcranial Doppler. So we're not talking about the most common PFO cases. And I think really we're talking about something at her grade would be 2 to 3% of the population at most would have something in her grade level. So it's now getting to be an uncommon type of PFO, at least something that requires treatment is very rare. Let's go back to Hailey here and get her to tell us more of her story.
What happened with me is my blood clot actually escaped through the flap or the hole in my heart, and it traveled to my brain, and that is why I suffered a TIA. So the recommendation from my doctors at UCLA was to have a procedure done called a Pfo Closure, which is when they go through your groin, through the femoral vein in your groin, and they travel up to the heart, and they put this small little button, it looks like a little button, that buttons close the flap in the heart, and then eventually your heart tissue grows back over the closure device, and that's it. And then you have it forever and you continue on with normal life. So I recently got the Pfo closure done and it went very smoothly. I'm recovering really well, really fast. I feel great. The biggest thing I feel, honestly, is I just feel really relieved that we were able to figure everything out, that we were able to get it closed, that I will be able to just move on from this really scary situation and just live my life. And it was definitely a really eye-opening thing for me. I definitely felt a lot of anxiety through the situation because from when the TIA happened to when I had the procedure to close the PFO, I just was really nervous a lot of the time about having another TIA or experiencing those symptoms again. And then I would get really bad anxiety, and my anxiety was kind of making me feel funny. It would make my fingers and hands feel kind of tingly, and I just honestly like had a really, really hard time in the in-between. So ever since the TIA, I have been on a blood thinner, an aspirin every single day. And I was also having an issue with the blood thinner medication because it was exacerbating my anxiety. It was making me feel very out of it, just really sleepy. But I was able to figure out the dose with my doctor, and now I feel much better. Now that it's all done, I feel so much relief, and I feel just so grateful to all of the doctors at Eisenhower Medical Center who took care of me, all of the doctors at UCLA who took care of me, Dr. Tobis, who performed my procedure and has taken really good care of me. Yeah, it's kind of like hard for me to tell this story. You know, I've only really up until now told friends and family and people that I know and that I'm close to, but I felt like it was important for me to share this, and because it already was like kind of a public situation and people kind of knew, but they didn't really know the full story, and I also wanted to wait to explain everything until my procedure was done and finished, and everything had gone smoothly and was okay. That's my story. That's what happened. If there's anybody that watches this that has gone through the same thing or something similar, I definitely really empathize with you, and I understand how life-altering and scary it is. And if there's anybody out there who sees this and has maybe experienced similar things but doesn't really know the reason or know why, I would definitely encourage you to talk to a doctor. And yeah, so this is what happened, and thanks for watching.
Well, I really appreciate Hailey Bieber for actually like sharing this story, because I think it helps so many patients to normalize these medical situations. It's obviously scary for her, and you know, I appreciate that she's willing to be so vulnerable and share some stuff with us.
Yeah.
One of the questions I have for you, she mentioned she's on blood thinners. What do you suspect? What would be the standard in a situation like this for? If she's on aspirin, would she be on antiplatelet as well, or would she be on like a like Coumadin or something like that? What would she likely go on?
Yeah, so let's take a step back first. Like we should ask ourselves why she actually had the procedure done, right? Like there's obviously a discussion that you have with the cardiologist and the neurologist who manages her at TIA. Is that for example in Canada, when would we proceed to have a consultation or get a cardiologist colleague to explore this surgical option? A few criteria includes like between the age of 18 to 60, somebody who has a pretty decent sized PFO, somebody who suffered from cryptogenic stroke. Cryptogenic means that somebody developed a neurological event, but we could not find a cause. That's what cryptogenic means.
Gotcha.
So then you have to blame it on something, and that
Right.
would be the PFO. And based on that, you sit down with a specialist and you say, hey, listen, let's weigh the benefits versus risks, and then move forward with the closure. So in her case, even when she suffered her event and while she was waiting for surgery, I was pretty certain that she was put on aspirin. Okay, because that's what you do when somebody suffered a mini stroke, a full-blown stroke, and you're waiting for all this workup. I think there's a few terms that were kind of described that might confuse our audience, and I just want to clarify. Blood thinners is often used in the general public based on basically anything that can thin the blood, right?
Right.
So
aspirin would be included in that.
Yeah, exactly. So aspirin, Plavix, clopidogrel, warfarin, and those things, right?
Yeah,
so,
Xarelto, whatever.
But when she kind of spoke it so quickly on that when she said I was put on blood thinners and aspirin, but then she developed some side effect from the blood thinners. So I would say that most likely that she was at one point put on aspirin. She at one point was also put on a more potent blood thinners within the realm of warfarin or the newer blood thinner products. And because those requires different dosage adjustment, and that's why when she said she developed a little bit more side effect of, she may have mentioned anxiety, which any drugs could worsen your or anxiety. So I think because aspirin, you're not really tweaking the dose. So that's just me speculating that she was at one point on aspirin, switch over to blood thinners. But one more thing is that people who have a closure of their PFO, it's not a gold standard, and this is going to be very specific to the patients and the provider on what they should remain on the future. So there's no guideline that says that people should be on, let's say, warfarin. I'm just giving an example.
Right.
Those common blood thinners historically versus aspirin. And most of you can pick 10 stroke neurologists out. They'll be saying that, you know what, this person just needs to be aspirin for life. Some of them will say that, you know what, I think that you should be on blood thinner.
Right.
One more thing before I answer that, you pop that question up, is that even with the closure of the PFO, you think that everything is resolved, done, she will never experience this event again. That's not necessarily true, because closing the right to the left shunt, yes, you're building a wall from the right side of the body to the left, but emboli can still form in the left side of the system. So regardless of PFO or not, you could still have problems. So I'll give you an example. As one gets older or they have cardiovascular risk factor, people could develop atrial fibrillation, meaning that they have an abnormal heart rhythm in the heart. And then when the heart beats sometimes it doesn't beat. What happens? It creates blood clot because there's lack of flow. And that could travel from the left side of the heart to the brain. So that's very important. It's not like a one-time fix.
Oh, for sure. And also, let's not forget, I mean, atherosclerotic disease is an important cause of stroke as well. Like over time, we all develop sort of hardening of the arteries, as they say, and you can get, a thrombus forming that way. But I think for her, it is exciting that she had a clear, in my mind, clear cause for this event that has a treatment, which will dramatically reduce her future risk of a stroke, which is great. What also interested me is the endovascular approach to closing a PFO. Now, this has been probably the most common approach for a while. You may know better than me, Tommy, but back in the day when I was first training, endovascular approaches for valves and congenital defects didn't even exist. The only endovascular approaches they had were stenting for coronary arteries. So really interesting advance in technology that she was able to have a minimally invasive heart surgery essentially to close a hole in her heart, which just in general as a surgeon, I'm like, that is totally cool. Totally cool.
Yeah, definitely. Like even with the transcranial Doppler, right? It's a non-invasive test, and to detect these microemboli. One more thing I want to say about kudos to Hailey Bieber for mentioning this time after time in her video, that there were times where she go through really bad anxious phase, and her symptoms, they get accentuated at those times. And in medicine, we see that day in and day out, particularly in my population, when they suffer from chronic pain and headaches, is that your symptoms is going to be worse. So it's very important to really address those symptoms as well, because or else you're going to get the somatization. You're going to get these symptoms that are like pins and needles in your hands and feet, palpitation, and you think there's something sinister going on. And I should emphasize that's why it's very important to continue to communicate with the people,
so important,
educated, right? And because you can read so much thing online, you could Google everything nowadays, and it's dangerous.
Hailey mentioned this. She had this genetic hand thing, and then the same viewer, Alice, said it was ectrodactyly. So basically, my understanding is that's going to be like fingers that are like basically partially conjoined, I think, with the skin, if that's what she's referring to. I'm not sure if there's an association between that and PFOs, but without a doubt, certain genetic abnormalities will have an increased rate of PFOs. That is well established in the literature, without a doubt. So there's like Is it the is the acronym Factorial? Is that the acronym? I can't remember. We had these medical student mnemonics, right, where you have these associations that include heart defects, limb abnormalities, those types of things.
Yeah, definitely.
I did not study for this podcast to mention that at
Medical
all.
students probably from the audience group would know a lot better if they're studying for the USMLE or the LMCC exam. They would be much.
They would know those mnemonics for sure. Yeah, and I would pull it if I ever had to do a test like that again. I would definitely pull those out. So here's the question. Here is the question that I wanted to ask from the get-go, and I've stopped you from answering this. Hailey Bieber reported migraines, that she suffered from migraines. What chance or what proportion of her migraine symptoms do you think were likely explained by a PFO in this case? She's recognized she's got a grade 5 PFO that they identified on transcranial Doppler. Could her migraines really have been this PFO? And could she expect or hope for at least to have fewer migraine symptoms after this treatment?
Oh, great questions. Okay. Like, I know you're holding me back for this whole podcast.
Yeah, the whole time.
I'm not a stroke neurologist, but then I am a migraine specialist. So, but then I know enough about from my neurological training to comment on what she experienced. Going back to PFO and migraine, the association is, I was mentioning this prior, is that there's even higher prevalence of people that have both. And they have actually looked into studies on what if we actually close the PFO, could patients experience less migraine with aura? Mm-hmm. And people have done studies over time, even though the absolute numbers of events may decrease compared to a control group, statistically, they will never be able to prove significance. And if people are good with research, they know that to prove something has a causation or association, you have to be statistically, you have to prove it that it's not due to chance, right? That's really what it means.
Yeah.
But they're never able to prove that. And so take another step back. Why does a PFO and migraine with aura have any correlation, right? Because we have been talking this whole podcast that yes, we understand the right to left shunt. We know that there's microemboli, and then if it goes to a blood clot to an area of your brain involved in certain function, then that would be impaired. The hypothesis with migraine with aura is that these microemboli travels up to the brain region, can actually causes a phase of what they call cortical spreading depression. And I'm sure Dr. Hilsden, you probably I've heard that term before.
Yeah, definitely.
It's a theory behind why people experience the aura phase of migraine. It's because there's a disturbance of depolarization of waves in the head, triggers by vascular events to triggers these sensory or motor or visual symptoms. So these microemboli could set off, like maybe it's like a light switch for people to develop aura. So that's why there are people that think that by closing it, you can solve that issue. And I was saying that for some people, like when you look at the numbers, it is reduced that way. In her case, what she experienced was actually a migraine with aura, not a transient ischemic attack.
Oh, interesting. Okay.
That question, nobody will ever know again, okay? Because you cannot prove it. You cannot prove it. Like what I said, because all her symptoms resolved, and all the brain scans were basically normal except the perfusion.
Right.
And she also is a migraine sufferer, and I believe she probably is a migraine with aura sufferer, based on what she said. And so I would love to sit down and talk to Hailey Bieber and just take a good solid week and just, hey, take me back at that breakfast table. Tell me, I will talk to Justin Bieber when he comes back to Stratford. And
Justin, Hailey, like hit us up when you're in town. You guys were only like a half an hour away from your house in Stratford, and we'd love to chat with you. I think the odds of that are zero going to happen. But I'm going to put out there in the universe. If you get Hailey, if you're watching this, invite Tommy over. We'd love to chat about your condition. Yeah, but I'm sure if you did sit down with them, you would get those key details.
Yeah.
So and basically what you're saying though at the end of the day is that there is evidence to suggest that she could have an improvement in those types of symptoms.
Yeah, yeah. I want to see also that if she suffers from migraine with aura, like would those be reduced as well? Obviously, like I hope that she would never experience any transient ischemic attack events again now with the closure, and now that she's on maybe antiplatelets or coagulation. One thing I want to say that when people were put on this medication, it's not just benefits with no risk, right? Whenever you put on anything such as a blood thinner, the reason why we don't put everybody on a blood thinner is that for people who are young, active, or even older populations where they have a tendency to fall, your bleeding risk is going to be much higher, right? So it's not like aspirin or other blood thinners are just completely safe things because people think aspirin they could just find over the counter. It's safe, right? It's not necessarily true. You bruise easier. You might more likely to have GI upset or GI bleeding. So I think that's why even now with new data, I think this is very off topic, because I'm not sure you're aware of. Many years, people are taking aspirin for a primary prevention for heart attacks. Primary prevention means
when I was a family doctor, that was the standard of care. If you were over the age of 55, now we would basically try to give it to people who had some risk factors, right? But by primary prevention, they had never had a stroke or a heart attack. They had not had any of those events.
Yeah, but now, based on large population studies, now 10,000s or more, they actually realized the number needed to harm. Sorry, I'm using like very jargony here. Like you actually more people will have more harmful side effects than benefits when you look at the total numbers with bleeding risk. But anyway, that's kind of off topic.
But that's a great point, because that is a change in practice, and it was something that we were still doing for the longest time. People, back in the day, they said, everybody should be on a statin, they should be on aspirin, and even like an ACE inhibitor. People say almost for everyone. And of course, we know now that medications have a lot of harm that you can't ignore. We do have a question for you, Tommy. As always, you get the most interesting questions. Does light sensitivity cause migraines?
Yeah, so light doesn't cause migraine. Migraine is genetic conditions that you already have, right? So, and then you can get symptoms associated with migraine, including developing auras or headaches. And light sensitivity is one of the symptoms of migraine or migraine attacks. So it doesn't really cause it, but people, when they're exposed to a lot of external stimuli, like a bright light, fluorescent light, computer screen, that sometimes could be enough to trigger a migraine attack. So I know I'm always very picky on the words choice of word uses. Causation is obviously often things that I'm trying to avoid using, but it could be part of a migraine attack, or it could be a trigger.
So probably for Anashka, she's probably using the term cause really when what we're saying is trigger. Those are like
Exactly.
It's not the light that's causing a migraine, but maybe certain types of light is triggering a migraine. Exactly. A good example of that would be seizures and epilepsy. And again, I may be out of date on this, but back in the day, flashing lights used to be thought of as a trigger for someone with certain types of epileptic disorders, very specific types, could potentially be a trigger. Certainly not a cause, though. It's not like if you were a healthy brain, you're not gonna, you're watching like a movie with flashing lights or a video game, you're not gonna all of a sudden develop seizures. Is that right, or am I wrong on understanding that?
That's correct. Actually, when you do, again, this might be a little bit off topic. When people get a test done for seizure activity called an EEG, they actually have a protocol where they could do photosensitivity stimulation. So they actually purposely flashes lights in front of you in hope to trigger one, so we could record one.
Right.
So you're right, but if you don't have it, then like no matter what I do, I couldn't trigger something.
Right, you're not going to cause a seizure. Although seizure is an interesting topic too. I'm going to put you on full screen here, Tommy, for a second here, because we have one more question. We got to switch you up here. Oh no, bit of a fail here to put you as the primary person here. There you go. So I'm totally blanking what I was about to say. But anyway, let's put another question on. Alice asked this question. Do you remember the reporter of the Grammys who had a migraine aura on air. There's actually been a few interesting videos. We don't have any to show today of people who've had live neurological deficits.
I remember exactly that video. What Alice is alluding to. It was a very nice video. I encourage people to Google YouTube that because it's she was clearly having a language aura, meaning that there's a lot of word disturbance that she was getting at the time, and it was quite like dramatic. It was very interesting. And sometimes I want to say people could get aura without headaches. It's not uncommon, but not super common. So that's why even going to Hailey Bieber's case, never should they actually mention she developed a headache in that whole sequence.
Right. Okay.
Not at all that word was used. So that's why it makes me do think that she did suffer from a transient ischemic attack.
But it doesn't rule out the possibility that this was still a migraine.
Yeah, because there are a lot of overlaps with migraine, with aura, and transient ischemic attack. And me and my stroke neurology colleagues, like who works at the TIA clinic, and I see a lot of migraine patients, we have a lot of referrals back and forth because sometimes we're just too similar, and we couldn't really discern that. And that's why it's important to sit down and really talk to the patient to see, like, wait, take me back to what happened. Like, it was in the video, like exactly like what I was saying. Let me watch the video, then I could tell you. Just like watching Bruce Willis trying to analyze all the aphasia. And neurology is very interesting, Dr. Hilsden. It's like a detective. It's like watching House, right? Like every episode, you're like, tell me more. I'm getting more clues now.
Right, so, you're putting the puzzles together, which is probably what excites people about doing your field for sure.
Yeah, you can see I'm really excited.
Well, and this is a great topic because we had an opportunity to see someone's story really from the beginning and the treatment, and we had opportunity, you and I, to speculate as to what was going on and get more information from us. It's been just an awesome opportunity. You know, we were right about a few things with what the little information we had back in early March, and wrong about a few things. And with a bit more data, we were able to conclude more. And if there's anything I can communicate to our audience about here, is that's what the encounters are like in the healthcare system. You can't necessarily expect that your doctor is going to have the right answer the first time, every time. Sometimes we have to build a story, and we need more tests, more time, more history, more opinions to come up with the right answer and treatment for you. And I think Hailey Bieber's case really grounds us and helps everyone understand what it's like to have a condition investigated, and what you and I have done over the past month to kind of analyze this and think about it has been fun, and it's great to see how this turned out in the end. Well, once again, it's been an hour. As always, Tommy, you and I can talk about these subjects really endlessly. So I think we'll end it here. I just want to say thank you once again to the audience and the questions that you gave us. We really appreciate it. If you've enjoyed this video, please give us a like and a subscribe to the channel. And once again, thank you, Tommy, for joining me live to talk about another neurological case.
My pleasure. Have a great day, guys.
All right. Have a good night. Okay. Bye-bye.